This week on 100 Huntley Street, we're dealing with the very important topic of depression and mental health, which affects Canadians of all ages and backgrounds. And today we focus on youth and young adults. People between the age of 18 to 24 have the highest prevalence of mental disorder than any other group, and youth suicide is the leading cause of death in young people ages 15 to 24. So what can we do about this? Dr. Jon Lee is a child and adolescent psychiatrist. Jonathan, good to have you back on 100 Huntley Street.
Thank you so much.
Now, we heard earlier from Rachel, cutting and all the things that she's doing, a college-age student. Why is this such an epidemic?
Well, I think it's just a reflection of young people not really being taught or trained or learning those coping skills that would be effective to help them metabolize the stresses that they deal with in day-to-day life. I think in the past, we had a lot more mechanisms to sit down, to talk, to reflect, to journal, and these days it's much more instantaneous. We want that quick fix, and cutting and other sorts of behaviors sort of offer that quick fix mentality in the moment, right?
Is it getting worse, in your opinion, from, say, when I was a youth?
Yeah, I think part of it is social media, Greg. I think there's a lot of contagion effect now, and there are a lot of young people who are posting images of their cutting behavior or other sorts of actions, and they're getting a lot of positive, unfortunately, reinforcement from other individuals who behave in this way. And so multiple people are encouraging them to cut and to enact their own aggression towards themselves.
So when you're talking to these young adults, they're coming in despair, some cases, some going, hey, this is just kind of the way this culture is. How do you deal with that? Because obviously some would be in denial and others would be going, help.
Yeah, I mean, I think that the biggest thing that we can do as health professionals, as family members, concerned friends, is really to sit down and listen and hear what the story is all about, because the cutting may be sort of a final common pathway of a number of different difficulties upstream, right? So being willing to sit with attention there with a young person to ask, hey, what's going on? I'm really concerned about you, and to communicate that message that you were there for them, even in the tension.
And, to be, in a position where you are harming yourself, there obviously is something that they are not feeling adequate about in their own lives. And how can parents, grandparents now, how can we help, the young people, not only in our own family, but in our communities?
I think that goes back to the concept of validation and really being able to hear and to listen. The scripture would tell us, be quick to listen, slow to speak. I think a lot of times in our cultures, in our families, in our homes, we're really quick to give advice before we really understand what is going on. And so in those instances, my advice to parents and to family members is really just to take stock. If the child is acting out in this way, don't take it as a reflection of your failed parenting or any other thing per se. Really take that time to listen and to communicate verbally and non-verbally that you are here for this person.
Now, as a father of four and having three daughters, and every personality is different, and and after one of my daughters had finished high school and was into university, started to tell us about the bullying, the things that were going on. I mean, are we making any progress here, Jonathan? There's lots of awareness, but are we actually turning the tide on some of these things?
Well, I mean, yes and no. It's really hard to say from a broad perspective. Of course, the people that I see in my day-to-day practice, they have faced the real brunt of that issue, right? So I do think raising awareness has had the positive effect of people talking about these issues a lot more and hopefully seeking help a lot more. The pall, the stigma is lifting. And at the same time, I think there's still a lot more work to be done in schools, in families, in homes to really support our young people.
I mean, there's some pretty dark things that have happened to young people, and we're now this culture where the sexual accusations, abuse, things like that are becoming more prevalent. So I mean, when people are involved, especially young ladies, but guys as well, when they are doing the cutting things, they probably have had, do you think, some kind of traumatic event in their lives that have caused such a drastic thing to happen?
It really varies from person to person. Definitely there are young people who have severe histories of trauma, of emotional and physical sexual abuse that end up with this cutting behavior. And then there are young people who have been coached, who have almost been trained in this way to cope with their emotional difficulties in this way. So it's hard to say, of course, every person is different, as you mentioned.
What advice would you give? I guess, you've got for the young person watching today, the parents And we also have a lot of grandparents watching, and they are seeing, potential danger, or maybe the child is in danger right now. What would you say, first off, to the young person?
I would say 100% safety is key, and things can't get better, unfortunately, if you carry out certain actions. So before you walk down that road of suicide, before you walk down planning that road, reach out. There are a number of avenues of help available immediately, helplines that are available to you, the emergency department, and really looking for that help in your community, looking for that support, because it is available to you for the young person. For family members, I think, again, it's learning how to tolerate one's own distress in this situation, and then coming back and saying, hey, son, we love you. We are here for you. We are on your team. Communicating that affection and that stable love for this person, irrespective of what they may be doing at that time, is so vital.
Well, Jonathan, thank you again. Some great words of wisdom for us. We appreciate it. And we do have our prayer lines. And if we'll try to connect you with the right resources as well. We're not experts in this. They're people that love God, but on the other end of the prayer line. So if you have a prayer request, or maybe just to agree with somebody that, my daughter, my son is in trouble right now, I need some help, 1-866-273-4444. Our prayer lines are always open. We'll be right back.